Good evening, everyone. My name is Marquay Ball, and I serve as the president of the board of directors for the Alzheimer's Diversity Outreach Service Organization. Now, today, we are excited to be hosting our second roundtable discussion on health disparities within the African American community and diverse populations. Now, before we begin, I would truly be remiss if I did not say thank you to my good brother and sister Guy and Yvette Troop for partnering with us yet again and giving us an opportunity to host our live discussions right here at the Black Wall Street Liquid Lounge, which is in the middle of the historic Black Wall Street district on Greenwood in Tulsa, Oklahoma. Now, the month of July is recognized nationally as Minority Mental Health Awareness Month, and we are honored to have with us some of the leading professionals within our very own community concerning this very important topic. Now, Ray Barrow, she wrote in a column on online publication Alzheimer's News Today an article entitled Alzheimer's Disease is Not a Mental Illness. In that article, she noted that Alzheimer's is a brain disease, and people diagnosed with Alzheimer's may display similar traits to those with mental illness. However, Alzheimer's disease is more accurately defined as a brain disease that's a progressive neurodegenerative condition. And there's a difference between the two, which leads us to our discussion today. And our goal is to help dispel the myths and misconceptions of mental health illness and the Alzheimer's disease. And we have a wonderful roundtable discussion panelists with us today. These are individuals that are already assisting our community in getting the help that they need and overcoming many of the barriers and disparities that we face on a daily basis, not just locally, but nationally as well. And we are excited to have Dr. Nicole Washington join us today. Now, Dr. Washington, she completed her residency in psychiatry at the University of Oklahoma, right here in Tulsa. And since the completion of that residency training, Dr. Washington has spent the majority of her career caring for and being an advocate for those who are usually not typical consumers of mental health services, namely underserved communities with severe mental illness and high-performing professionals. Now, through her private practice, her podcast, her speaking, and her writing, she seeks to provide education and awareness in order to decrease the stigma associated with psychiatric illnesses. And also we have joining us Dr. Philip D. Lewis. Now, Dr. Lewis is a native of Memphis, Tennessee. He's also a certified rehabilitation counselor and a licensed alcohol and drug counselor candidate. Now, presently, he serves as an associate professor and graduate coordinator of the Department of Rehabilitation Counseling and Disability Studies at Langston University in Tulsa, Oklahoma. In addition, he also works as a licensed mental health professional with the state of Oklahoma. We also have with us Izetta Gibson. Now, Izetta is a licensed clinical social worker and a licensed alcohol drug counselor with over 15 years of experience working with diverse populations and with those who are challenged with chronic homelessness, mental health, and substance abuse disorder. Izetta has also worked with individuals and their families to identify and resolve barriers that prevent them from living stable lives. Now, as the director of clinical services, she also works with staff members to help people and families reach and meet their housing and employment goals. And lastly, and certainly but not least, we have a dear friend of mine, Mrs. Carmen White Yannick. Now, Carmen has studied sociology and psychology at the Texas State University. Carmen is also the CEO and founder of Interview Consulting Group, and she is currently hosting a weekly support group in partnership with the Mental Health Association Oklahoma around coping with the trauma from racial injustice. Now, she was also recently appointed to the board of directors with the Mental Health Association Oklahoma. And moderating our discussion today is none other than our very own executive director of ADOS, and that's Reverend Beverly Ball. So now that you know who's going to be at the table with us today, let's go join in the roundtable discussion on mental health awareness and the effects of Alzheimer's disease within the African American community and diverse communities as well. So welcome to the table, good people.
I am so excited to have each of you here with us today. I cannot say enough about each of you for your professional positions that you hold in the community and for the knowledge that you're going to bring to this roundtable discussion. So I just want to say personally, thank you for accepting the Alzheimer's Diversity Outreach Services organization's invitation to the roundtable discussions. Today, we're going to be talking about mental health and the difference of mental health and Alzheimer's disease. We want to help our community to know more about the disease, but to also know the signs and the difference in mental illness and also Alzheimer's disease. So we're here to hear what you all have to say. So we're going to get that conversation started. Dr. Lewis, thank you so much for being with us. Thank you, Dr. Nicole. Thank you, Izetta, and thank you, Carmen, for being with us this evening. Dr. Lewis, tell us what you see within our community that is affecting the African American community and diverse populations when it comes to mental health and the education that we need professionally to know how to help our loved ones that are struggling mentally. Mm-hmm. Can you help us?
I think personally and professionally, I see that there's a great deal of miseducation as it relates to what mental health is. Okay. And there's have been some huge discrepancies as it relates to diagnosing and labeling. Okay. And so within our community, I think there's a lot of false narratives as it relates to mental health. Okay. Whether it's Alzheimer's, whether it's depression, whether it's anger, whether it's aggression, it's kind of been all clumbled up together when the behavior is somewhat erratic or abnormal. So I think the best thing we can do is enhance our healthcare literacy as it relates to those things that matters, in which we have so many disproportions, when it comes down to mental health. And Alzheimer's, I know it hits close to our homes, in which I know that we've had so many negative narratives that oftentimes label our community, and you wonder why don't nothing get done. Okay. Because what do people do when they don't understand something? Okay. They fear it. Mm-hmm. Yes. They push it away. 100%. They shy away. Okay. They don't want to do anything. And so I think those false narratives is the greatest danger. And that's why at Langston University, within our Health Disparities Project, we try to host common symposium similar to the CELF to have a safe place, to talk about these things from those individuals that are intrinsically motivated. So thank you, for taking a leap of faith to get those professionals together, because we're so segregated among each other. So that's true. And this we have to minimize that. That's true. Opinion. So having our safe place, to explore some of the miseducation about the labeling, I think is our first step to a true treatment resume for the miseducation. Of the Negroes.
Absolutely. But we also need more of us too, right? There needs to be more of us, because it's unfortunate that you have to put on a symposium to create a safe space for Black people to come to be able to get the information they need, right? So ideally, there would be so many of us in mental health, whether it's your therapist or your doctor level people or your physicians, your psychiatrists, there'd be so many of us that they could just come to one of us and have a conversation and it be a safe space. Because how often do we see we send people to psychiatrists or therapists who aren't Black? Right. That's right. And they have, and I'm not saying that all white therapists are not able to take care of Black people. Right. But if I'm a Black patient and I have to spend 10 minutes explaining to my white therapist what I'm dealing with for them to be able to help me, that's a problem. Yeah. How many times do I get a referral, and if the patient is described as, they're difficult, I take care of a lot of doctors and lawyers and stuff like that. And so, I'll get these referrals and they're like, oh, she's difficult. She's defensive.
Right.
She's aggressive. Right. And it's almost always a Black woman when I get those kind of referrals. Right. So if you see them as aggressive and defensive and angry, but then you see other people as assertive and standing up for themselves and doing all that stuff.
Yes.
That's not going to make me want to come back to a therapist.
Right.
It's not going to make me want to come back. So we have to encourage kids to, what about becoming a therapist? What about being in therapy and then seeing benefit and going, ooh, I want to do this for somebody else, which is a lot of your story, right?
Yeah, because I mean, it's no accident that I took my talents to HBCU.
Yes.
I could have went to the University of Arizona, I could have went to the University of Tennessee, and probably made more money. But through the master's and the doctoral program, I never saw a reflection of me. All right, and there's still the same disparities, should I say, the gap as it relates to seeing someone that you can identify with. But just peep this. If you're having a mental health crisis of any sort, the last thing I need to worry about is if I trust you.
Right.
That's the last thing I need to worry about.
Excuse me. Yes. 100%.
When we think about reconciliation efforts, anytime I have an opportunity to speak publicly about it, for those individuals that matter, that say that they want better race relations in all areas, I say, if you mean that, you would do what you have to do to make sure that those individuals providing the services are just as reflective of the consumers.
That representation matters.
Yes,
Both of you
does.
said something that sparked something for me. I went to college because as a 10-year-old Black girl in South Texas, my father died at 37. He was a military man. And I still can remember the military walking up to our house and knocking on the door. We were watching American Bandstand, me and my brother. And so this is 1975. How many of us were in mental health? In 1975.
Yes, you're right.
So my mother I still say, this is one of the greatest gifts my mother ever gave me, and that was the gift of therapy.
That's good.
My mother
During that time?
In 1975, my mother made this decision. I remember standing at the altar in my great-grandfather's church, and one of the deacons, who was a good friend of ours, said to my mother, "You have no business taking these children to a therapist. They're gonna mess with their heads." And she said, I was standing there, she said, "You have no business telling me what I should do with my children, because you, sir, are not there when they're crying themselves to sleep every single night. And they don't see me when I go to the other side of the house and cry myself to sleep at night, every single night. So no, I'm making the decision. This is the best decision, and it radically transformed my life. And I sat there with Dr. Edgington and said, if she can do this for me, I want to be able to do this for other people. I made that decision, but that's 1975, y'all.
But this is still the problem.
It is still the issue, which is why I still talk about it, because we need to know that there's longevity. I was 10 years old. I'll be 57 in December. But for 47 years, I have a track record with something that my mother sowed into my life, which is still why it is one of the greatest gifts she ever gave me. Has she given me other things? Yes. But do I remember all of those things? No. Do I remember this? Absolutely.
That's good.
And because of it, I've been able to give that gift to other people who look like me.
Right. And can I say, and I just want to say, 20 years ago, when the Alzheimer's Association, and I appreciated them for this, because when they came to me, they made a decision. They recognized the need to have someone in the community that would assist with the African American community. So I was grateful for that opportunity at that time, and that was over 20 years ago now. So with them giving me that opportunity to go into the community and educate African Americans, and there be no shame, there be nothing, no strings tied to it. Just go and educate your people. Why? Because they are number one on the list for this disease. The statistics are highest among the African American community. So educate them. And that was, to me, a gift. And I think I shared with you all earlier that my grandfather had this disease, and everyone ended up in his community calling him crazy. That was very painful for us as grandchildren, because we had seen him as a strong man, a strong husband, a strong grandfather. Right. And then with his life ending, for someone to say that he was mentally disturbed, disturbed me. So to learn what I have learned and to be able to share the information, and my prayer is and will be until my assignment is over with, that someone will take it from this level to another level as far as educating in the community about Alzheimer's, because it is so high. But this is Minority Mental Health Awareness Month. Yeah. And what better month for us to assist with our family members and our friends and our neighbors, our churches, just to say, if you are struggling with a mental problem, if you know someone that's struggling, if you know someone that is so stressed that they refuse to go see a therapist, then it is our responsibility to say, encourage them, get help. Right. Get the help. Go to a therapist. Talk to your pastors. Talk to someone that's a Christian counselor, or talk to a psychiatrist. Talk to someone, that you can relate to get the help you need. Now, Ms. Gibson, please share with us what you do in the community that assists us with this type of issue.
Well, I work right now with the Mental Health Association of Oklahoma. So we have over 200 apartments. Okay. We have an outreach team, we have case managers, and that's a lot of what we run into. Okay. The family piece. If you have a family member that was killed, you're grieving. If someone dies, you're grieving. No, we just go to church, you're going to pray your way through. We can pray and go to therapy. We can
at the same time
and add other things with it. And that's, as a case manager, I feel our job is to advocate, because a lot of times if they don't trust us, they'll never get to the psychiatrist. Right. They'll never get in. And so sometimes we have to sit there with them, supporting them. And it's like, let's write down what we want to talk about. Right. So if you go to some of the bigger organizations, you literally got 5 minutes. Right. So if you spend 3 to 4 minutes fumbling, you got a minute. Right. So we write it down, and that's from the case management, community mental health, outreach perspective, because we're going to see the people on the street. Right. Like, we're going to go to them every day just to get them to talk to us. And now that population is aging. Yes. Wow. And so we have to educate ourselves more in everything. As a case manager, you have to know everything. Right. Because you're only going to get one opportunity. So you have to be able to jump in at that. So that's what I want to speak to. I applaud your mother's courage, because a lot of people will not. Right. And I'm just like, so if it didn't work, we're going to keep doing the same thing. Right. So that, as the services side, and the Mental Health Association is the advocacy group. We built in services because we wanted to get there without barriers. Right. So that's what we do when we see that population getting older. We have people now that we're like, okay, we can't support them. Right. So we have to learn. We'll be on the phone calling everybody. Life-saving services, we're going to call
the resources,
whoever we can, so we can help them get to a place of, living their best life, whatever that may look like.
Right. And I think it's through partnerships like this that we can get to that place, because whoever said no man is an island, you cannot do this by yourself. That's a true statement. We cannot get to the helps that we need if we're going to hide the problem or act as if there is nothing wrong with my grandmother.
And we're used to masking now.
Right. There is absolutely
even before the pandemic. Even before the pandemic.
Way before.
Way before.
Yes.
So, I think in partnership, and that's one of the things that we do with our organization is that we are a resource so that we can tell people this is what you need. I'm not a doctor. I think with our last session, a gentleman called me a doctor. I am not a doctor, but because of the experience that I have gained and the years that I have been doing this, I know the needs that people have, and I know the resources to send them to. I will tell a family member, your loved one needs to see a neurologist. They need to be properly diagnosed, so that they will know what is going on. I have literally heard families, and a couple of years ago when you were our keynote speaker, our theme was My Mind is Made Up. And I don't know if you remember that. And the reason our theme was My Mind is Made Up is because a lot of people make up their mind that it is nothing wrong, or they'll make up their mind, especially the person that has Alzheimer's, they sometimes have made up their mind that it is something wrong with them mentally. They don't understand that they have a brain disease. And I've literally heard people call themselves crazy.
Right.
I feel crazy. It's something going on in my mind. I feel crazy. And that breaks my heart because they will never know because of the disease process what is going on. But we have an opportunity to help them through their loved ones to make sure that they are well cared for, and that they not lose their way in their confusion. Because if you could when I think about the brain and how it's processing them through this, the 7 stages, it's painful to know those stages and how they are literally going to possibly end up without the proper care, without someone watching out for them, a good neighbor that's watching out for them and utilizing your gifts to help her and quietly get her back to a safe place. Well, can you imagine? And I said this the last time we met, when Dr. Alzheimer's discovered this disease, he discovered it in a 50-year-old woman. And she was placed in an insane asylum. That was in 1905. That was in the 1900s. Wow. So you can imagine how many people have ended up in mental, being called mentally disturbed instead of, properly diagnosed.
People want to screw holes in people's head. They let the demons out.
Back in the day.
People, whatever people would do within our family, we hid.
That's right.
We had that uncle.
And
everybody has somebody
upstairs.
That's right.
And nobody else saw.
Like Soul Food. The movie Soul Food.
And it's real. We all have an experience like that.
That's
somebody
true.
in our family, I had someone in my family like that. And we were told, you don't go back there.
See,
leave him alone.
Yeah.
We don't talk about that.
Right.
But he had, it wasn't until later in his life, right before the end of his life, that he actually got diagnosed with bipolar. He was bipolar, but we didn't know that because that wasn't conversations that we had, because it was beyond our understanding.
Exactly.
And the other thing that I want to say, because I think it is really important, you touched on it, Ms. Beverly, it is Jesus and therapy, Jesus and medication.
Right.
But when you are not informed, and you have to come to the end of yourself. So every pastor is not a therapist.
Thank you.
Right.
Every
Thank you,
pastor,
Jesus.
yes. Every pastor, and I'm not downing pastors because I've been in ministry for 35 years. I'm not saying that, but what I am saying is you have your level of expertise.
Right.
And when you're beyond your level of expertise, you have to say that, because in our community, we know that pastors, ministry leaders hold high esteem in our communities. And so you cannot abuse your power as a leader, as a ministry leader, and not say to that person, ma'am, Sis, brother.
You need more than I can.
You need more than what I have.
More than what I
My
have.
letters say something else. They don't say what you need. And so it's important to note that and to say that, because those in our audience who are going to be watching, there are folks who are inside of churches, who are inside of mosques or temples or synagogues, and we need to know that when your area of expertise has come to an end, we have to say that.
And even as caregivers, we're not experts at everything.
That's right.
You know, I have a rolling term, a phrase, should I say, with my students. You know, when in doubt, consult.
That's it.
Right.
That's good.
And that's smart of you.
That's good. That's good.
Because you're not going to know.
No.
I mean, especially when we think about human development in general, you know, I never try to educate or facilitate a cookie cutter approach to human development, because everybody is different.
Everybody.
Yes,
Everyone.
we can look at
And the
some common
circumstances are
sense.
different.
And the
right?
circumstances
are
are
different. Yeah, the circumstances.
And so we can look at some common terms or identifiers to help us to diagnose and treat.
Yes.
You know, but you have to start somewhere. You know what I mean? There's various treatment modalities that may work for you, may not work for you.
Right.
And that also comes with having a level of cultural competency when you're working with somebody.
Exactly.
Don't just, well, they're aggressive. No, that's where they're from. They're expressing to you. So don't be scared of that. It's like they're aggressive to me, and I'll go talk to them. I'm like, well, what's happening? I'm mad because I've been here an hour. Well, they mad because they've been here an hour.
Like anybody would be. Right.
We literally had a client say that the other day. She walked in the hallway, we're like, she's being so mean. She said, no, I've been here for 2 hours and nobody has come over here to help me. That was her issue.
Right.
She was not being out of pocket. She was not being mean. She was not being aggressive. She number one, she was in trauma.
Right.
Okay.
And in the midst of that trauma, she needed support. And I came to a place that you say is supposed to support me, and I ain't seen nobody.
Right.
So now she's antsy and agitated. So I was like, ma'am, we got you.
Right.
I promise you. So thank you for that, because that's real important to understand.
And that trauma stuff is extremely important, because a lot of times we don't dig a little bit to figure out.
Yes.
9 times, maybe not 9, maybe 8.5 times out of 10, when somebody is like just, you know, angry and mad and something like that, it's because they have some kind of trauma history, and somebody who was supposed to support them did not. So now they don't trust anybody.
Right.
So they don't. So you got to build a trust with the Mental Health Association, because if you say you're gonna do something and don't do it, it's gonna write you off like everybody else who said they were gonna do stuff for me and didn't do it. Right. Like, so that trauma, like, it'll just, you know, a lot of people who've experienced trauma, they just don't trust anybody, and frankly, they can be very angry because they can't trust anybody. I mean, I think we'd all be pretty irritable and angry if we genuinely felt like we couldn't trust anybody. And so, I mean, that's important for us to be aware of, you know, when we're having those relationships. And all of that even goes back to the education piece. As a pastor, knowing what you're, you know, if I'm a hairdresser and somebody's sitting in my chair and they telling me, I just feel like if I was dead, would nobody notice? That person might not say it, hey, I'm suicidal, but that's not a statement that a person doesn't make if they hadn't thought, like, it'd be probably better off if I wasn't here. That's a big deal, right?
Yes.
Like, we don't always say, like, hey, I'm suicidal and, you know, I'm feeling worthless or I'm feeling hopeless. Like, we don't go down a depression criteria and lay it out, you know, to people, but we say stuff, right? We start not showing up for stuff. We start not coming to get our hair done. We start not, you know, doing this stuff. And those are all signs, but if we don't educate ourselves.
Yeah, those are all signs of Alzheimer's.
And depression, and you know, I mean, so it's, you know, if you do suspect that Alzheimer's is playing a role, or some kind of mental health something is playing a role,
get the appropriate assessment.
You have to start to go get an assessment.
Yes.
You know,
and that's what is so important. And I appreciate you saying that, Dr. Nicole, because that's going to make the difference to me in our community as we educate, as we continue to educate, as we continue to have the roundtable discussions. This is going to make a difference in helping our community understand there comes a time, regardless of my beliefs, what denomination I am, what church I go to, whatever. If we need help, let's pull together. Let's get the help that we need. Let's partner. It doesn't matter to me what church you go to. It doesn't matter. One of the things that we have done is when we began this education in our community for the Alzheimer's Association, when I was full time with them, it was a faith-based movement. So I started out trying to educate pastors, and I continue to do that. And I will be having a roundtable discussion with pastors to make sure that they know, when it is time for them to help in a different way and not just talk about it, so that they will recognize the signs also. You don't hardly hear people talk about mental illness in our congregations of believers. That's something that needs to be done, because we can't just, like you said, ignore those things and feel like you said it, pray it away. Sometimes we need the right medications, or a person needs therapy, or they need to talk, they need counseling. They need a lot of things in order to get to that moment where they are safe and feel well and healthy in their mind, But Alzheimer's is a brain disease, and people need to know the difference in having a brain disease and having mental struggles, mental challenges. So, Dr. Nicole, what would you say? Because one of the questions that I did want to ask is, what signs and symptoms do you often find that families of Alzheimer's patients put off as a personality flaw? That they're really showing the warning signs. For example, not being able to work a microwave, and you have watched them use the microwave for 20 years, and all of a sudden now they don't know how to do it. What are some of the, what would you say? What would you say?
I want to say, because I don't like that we use the term behavioral health in general. Like I don't like that word, behavioral health, because I feel like it implies that you have total control over what it is that you're doing. And there are a lot of mental health disorders that I think are brain disorders. Like, there's, medication wouldn't help if there wasn't some kind of neurotransmitter or something going funky up there. But those are still different than Alzheimer's, right? Those are very different. So if you have a loved one who, like you said, is starting to not be able to use the microwave, they used to go to your house without problem, and now they're getting lost. People are calling you saying, hey, your mom's over here, she got lost coming in your house. Losing keys, forgetting to lock doors, burning up multiple sets of pots is one that I'll see. Like, oh, we've gone through some pots because she's burned through some pots. Those are things that if they're happening over time and you've noticed a progressive kind of change, then that leans us more towards something like an Alzheimer's process, but they still have to go get evaluated. You still got to go to a doctor and get lab tests. There are vitamin deficiencies that can look like dementia. Mom or dad, grandma, grandpa may be drinking a lot. And that can affect their cognitive ability. We tend to not think of our grandparents as having substance use problems, but they might. And especially as our population ages, I'm seeing older people doing things that we just never considered older people to do. You never considered an older person would be, using drugs or drinking, but they have been since they were young. And as our population ages, they're doing more stuff that we don't typically do. There are physical health things, right? As we get older, our bodies are super sensitive to things. So whereas, 40-year-old person gets a urinary tract infection, they might be fine. They have the symptoms, they go get the antibiotic, they're good. 80-year-old person gets a UTI and they're psychotic.
That's right.
And
the older
they're psychotic and hearing voices and thinking people are trying to kill them. And so if the change is more kind of in the short term, as opposed to kind of you've seen it progress over time, like an Alzheimer's kind of thing, we might consider that to be like a delirium, like related to a physical thing. So you got to get this stuff checked out. We can't just say, oh, grandma's, that's just grandma. If grandma hadn't always been cussing like a sailor, we might want to check that out. Now, if grandma been cussing since you were a kid, maybe that's just grandma. Maybe she just likes to cuss everybody out. But if that's not grandma's personality and something is different, we gotta get that stuff
Yes.
checked out and
Yes.
not just kind of go with it. And even depression in the elderly can look like dementia. So we need to like
Yes.
assessments with the right people, getting in front of the right people.
And I think what people don't understand, and we're getting ready to maybe close this conversation out, but and I hope that we can come together again. But one of the things that that I know is happening in our community that we really, really need to pay attention to, and that is that we just need to continue to know the warning signs.
Yes.
You know, in our own professions, you know the warning signs. And we're going to put those up on the screen so that we can keep those visible for individuals in the community as we're, educating throughout the months. Make sure that people know that and share that information,
Thank you for saying that, in which we need to normalize the warning signs. That's the greatest challenge is for us to normalize because we're so used to labeling.
Right.
Negative characteristics as it relates to treatable diagnosis.
That's true.
And so, I think the river of loss of memory, the river of being confused, the river of losing some sense of cognition with the progression of age, it's in all of our streets.
Right.
In which, I want to say that, I've been cycling a lot lately. And I'm 300 pounds, but I tell you what, if I would fall out on any given day, you don't have to have your CPR certification to help me.
Right.
You just go on, jump on in there with what you think you might know to sustain me. And I want that to be known within our community, that you don't have to be an expert.
That's right.
Yes.
That's right.
Just have
normalizing these conversations, Dr. Phil.
So we can minimize the fear, and when we can jump in and not demean someone, exactly.
Yes,
girl, you're not depressed.
Exactly.
Ain't nothing wrong with you.
Nothing wrong with you.
Right.
Girl, you all right.
Because people, we're so focused on PTSD, but we're not focused on PTG, post-traumatic growth. Let's learn to grow through what we go through. Let's learn to be able to talk with one another.
That's good.
Instead of running away from one another and hide. Those things that's going on, even in our minds.
Right. And I know we are running it close, but I think that's important, right? Like, it's what we've done. Black people have, everything we have done out of trauma. All the stuff that whole post-traumatic growth model is what we do. It's what we do. I hate to describe people as resilient. Without focusing on, most of the time people are resilient because they were put in crappy situations where they had no choice but to be resilient. But it is a strength that we've had. But we can't just stop at, but we're just so resilient.
Right.
Because I think when you continue to praise all that resilience, then people stop trying to help you because they're like, well, they'll figure it out.
100%.
They bounce back. They're good. They'll be fine.
And black people have definitely been tarnished.
Right. So it's that growth model is great, but we also got to, at the same time, make sure we're working on the back end to try to eliminate some of those things that force us to be resilient.
Right.
Yeah.
In the first place.
Well, I want to say thank you to each of you for having this conversation with our organization and for lending an ear to what we are trying to do as an organization when it comes to educating families in the community, knowing the difference in mental challenges and Alzheimer's disease. That's going to make a big difference as far as helping caregivers, family members, neighbors, friends, congregations, whatever. It's going to help them at least learn how to make the difference and to be able to assist families with knowing where to send them, how to get the help that they need. Each of you are valuable, I feel, in our community, and I am grateful that you have joined us at this table. What we can end by saying this, and that is, if you find yourself stressful, this is what we can tell people. If you find yourself in so much stress, get some help. If you find yourself full of anxiety, no matter what age you are, no matter what position or title you wear, because people are stressed on all levels.
Yes.
Pastors, we've had pastors all over the United States that have taken their lives.
Yes.
You know, I mean, people are stressed. It doesn't matter about a title. So you can be mentally stressed and full of anxiety and get some help. You know,
And if it doesn't work out, go to somebody else.
That's right. That's right.
And know how to defend what you believe and know how to express what is going on. And that's one of the things we need to learn how to conversate and converse with professionals. And I thought that was a wonderful idea to write down, because I take a list to physicians. If I have questions, I have my list pre-made so that I will be able to.
When somebody comes in with a list, I'm so happy.
Yes.
I love a list.
So we can stay on course and we can get the help we need. Again, I want to thank you all for joining us at the table. I hope that we can do this again. I hope that the audience that will view this will be helped. They can send in questions, whatever. I just hope that we will get the views that we need. So share this information. Thank you all for joining us
Thank you.
at the round table
Thank you. This has been
discussion. Appreciate you all. Thank you. Thank you so much. Again, it is our hope that our roundtable discussions will lead us into living a healthier lifestyle and encourage our family members, friends, and community to join us in the movement of changing the projected lifespan of African Americans and other diverse populations. We invite you to go to our website, alzoutreach.org, for more information about our organization services and resources. And for a free consultation, call 918-514-3154. Or email Beverly Ball at alzoutreach.org. If you would like to make a contribution to help us continue educating families across our city, state, and regionally, we have several ways for you to give. To make a contribution by Cash App, $ALZ Outreach, or you can visit our website at alzoutreach.org and give. We also have a GoFundMe. You can also help us by please liking us on Facebook and subscribing to our YouTube page. Thanks again to our wonderful guests for sharing their knowledge with us today. And we take this time to extend an early invitation to each of you to please join us at the table again in August. Thank you.